You are welcome to my channel. How are you doing and how is the pregnancy journey going? In this episode of Antenatal Health Talk, I'll be discussing about immunization in pregnancy, routine investigation, routine drugs, and scan. If you want to know about all these, watch this video to the end so that you are not left out. And if you've not watched the previous episode of my Antenatal Health Talk, I will drop the link in the description box so that you can watch and be in line with all the health talk I'll be giving. Let's get into the video. Tetanus is an infection that enters the body through open wounds, and when it enters the body, it produces toxins causing painful muscle contractions. In order to avoid this, pregnant women are vaccinated with the TT vaccine in order to prevent them from having tetanus. And once you get this vaccine, it's going to create an antibody in your body which is passed to your unborn baby, protecting your baby also from tetanus. And once your baby is born, at 6 weeks, your baby is going to get its own tetanus vaccine, which is included in the baby's immunization schedule. What happens when you take tetanus vaccine? During pregnancy, you are supposed to get about 3 doses of tetanus vaccine, depending on when you started your antenatal care. The first vaccine is not going to protect you at all. So when you take the first vaccine, after 4 weeks, you are going to get the second vaccine. The second vaccine is going to protect you for 3 years, and after 6 months, you are going to get the third vaccine, and the third vaccine is going to protect you for 5 years. If this is your first pregnancy or you've not had tetanus vaccine before, you are going to get your first dose immediately you register for antenatal, and you are going to get your second dose 4 weeks after the first dose, and you are going to get the third dose 6 months after the second dose. When you take the first 3 doses in pregnancy, which means you are protected for 5 years, or when you take the first 2 doses, which means you are protected for 3 years. And if within 3 years you get pregnant, you are going to get a booster dose only. That's just a dose. But if you exceed 3 years or 5 years, depending on the doses of tetanus vaccine you had, that means you are going to start again. You are going to get 2 doses, which is the first and second dose. But if you get pregnant within that period, like before the TT vaccine expires, either 3 or 5 years, then you are going to get only a booster dose. Tetanus vaccine is usually given on the left upper arm, and it might be painful. The injection site might become swollen or painful. So after getting the vaccine, you can apply ice pack to that place, and you can also apply shea butter in order to relieve of swelling and pain. Routine investigation during pregnancy. In each antenatal care visit, your blood pressure is going to be monitored to rule out hypertension. Hypertension is very dangerous during pregnancy because it can affect the health of both the mother and her unborn child. And next is the blood group. What really matters in this blood group is the negative or positive time signs you or your partner's blood group carries. If you are carrying different signs, it can lead to rhesus incompatibility, and when this blood group is checked, you are going to be getting Rogan's vaccine. And what happens during Rogan and rhesus incompatibility is that your blood creates antibodies that attacks your baby's red blood cells, and this can further affect future pregnancies. Then the next thing is the genotype. Your genotype will be checked in order to rule out sickle cell disease, and you also get a viral screening done in order to know the viral state of your blood. Scanning is very important during pregnancy. Even if you have confirmed your pregnancy, either using a urine or blood test, scanning is going to show the location of the baby, the location of the placenta. It's going to tell the age of the baby, and it will also help to monitor the baby's growth. With scanning, you are going to know your baby's heartbeat and also the heart rate. Scanning also helps to know the numbers of baby you are carrying. The sex of the baby also is going to be shown by scan. So it's very important to get scanned during pregnancy. Routine drugs. It's very important that pregnant women adhere to taking their routine drugs because it will help to increase their blood volume, and it also increases the chances of having a healthy baby. Thank you for watching. See you in the next episode. Hope this video was helpful.